And good evening, everyone. This is Here's to You Good Health. No, I'm not Linda Prezioso. I'm filling in for her tonight. She's at a medical conference, so I'm filling in. And my guest today is Mary Kay Baker. So glad to have you, Mary Kay.
Thank you for having me. I'm glad to be here.
So glad you're here. Great topic tonight. Nash UNC has sent us yet another great guest. I love the guests that they're sending. You know, since we talked about heart so much because February was Heart Month. And it was so important to talk about the heart. And then we said, well, you know, strokes are important too. So we decided to, the hospital said, can we have Mary Kay on? I said, would love to, because of the statistics, which we will talk about later in our show. First of all, Mary Kay, I want to ask you, first of all, what is your position at Nash UNC?
So I'm a registered nurse. I am the stroke program coordinator. So I'm over the stroke program at the hospital.
Okay, very good. So what is the first big question to me is, what is a stroke?
So a stroke is a temporary blockage of blood flow that affects the brain.
Okay.
I like to think of it as a plumbing problem inside the brain.
Okay.
So what happens is there's three types of strokes, and we're going to talk about those. But what happens is blood is interrupted, whether by a blockage,
right,
whether by a bleeding, or a blockage temporarily.
Okay.
So you have three types of strokes. The first one is an ischemic stroke, which is caused by a blockage.
Okay.
So whether high cholesterol, a clot that formed from somewhere, such as from afibrillation or atrial fibrillation, that blocks it. Those make up majority of your strokes, which is 87% of all strokes.
Okay.
Then you have hemorrhagic strokes, which is bleeding inside the brain. So what happens is a weakened artery or vessel that ruptures, whether from high blood pressure or just a weakened blood vessel.
Is there one of those that's worse than another, or?
Hemorrhagic strokes carry a higher mortality rate, which is a higher death rate, but now advanced technology at the bigger institutions such as UNC, Duke, Vidant, they can do additional things to help treat those. The main thing
good
is
to know. Yeah.
The main thing is getting that blood pressure under control. Majority of them are blood pressure related, so if we get the blood pressure down, we can help stop the bleeding and reverse the bleeding if they're on an anticoagulant, which is a blood thinner, something like that.
Okay. We're going to talk about the different kinds of stroke, but first of all, let's talk about the symptoms, because that is so important to know the symptoms. And I believe you have some graphics that you brought with us tonight. So, Lee, if you could roll those graphics. As she is talking, we certainly want to know what the signs and symptoms are.
So the signs and symptoms that we teach the community is called BFAST. It's an acronym. So B stands for sudden change in balance or discoordination. So if you're walking and all of a sudden you fall, or you can't hold a coffee cup,
Could we have the graphics, Lee? Okay, there we go. They had to render a little bit.
Can we go back to the B first?
Yeah, let's go back to the B.
Thank you. There we go.
There it is.
So a sudden change of balance or discoordination is your first signs and symptoms of a stroke.
Okay.
So then the E stands for sudden loss of vision or eye changes. So if all of a sudden you go blind in one or both eyes, or you can't see out of the corner of one or both eyes, those could be a sign and symptom of a stroke.
That is purposefully blurred on that screen.
Correct. That is correct.
Yes, because that is about blurred vision.
Right. So just for example, we had a gentleman that was traveling on 95. He was a truck driver, and the first thing he complained of, he said, I couldn't see out of the left side of my eye.
Wow.
That was his only complaint. So we brought him in, we worked him up, and we'll talk a little bit about what we did for him. But yeah, that was his only complaint, was he couldn't see out of the corner of his left eye.
Well, it's a good thing he came.
Mm-hmm.
So was he having a stroke?
He was having a stroke. He was having a the back of the brain stroke.
Wow.
An ischemic stroke.
Okay.
Then the next one stands for F, which is fast, facial droop. So what you do is you have someone smile, and as you see on the screen, a facial droop or inability to smile. Or a drooping eyelid on one side of the face.
Does this possibly come back right?
Sometimes, yes, it does. Yes.
Okay.
Yep. If we can, we're going to talk about time in a few minutes, but if you can, the sooner you get to the hospital, the sooner the chance for us treating you,
Sure.
and then the sooner you treat it, the better the outcome.
Time is brain.
That's correct. That is correct. Time is brain. The A stands for arm weakness or arm drift. So you would hold your arms both out. If one falls down suddenly, or you drop a coffee cup, or you can't write your name with using a pencil. So
Right.
A stands for arm weakness.
Okay.
S stands for slurred speech. So we're sitting up here talking, and if I started mumbling my words,
Right.
or my words weren't making sense, so speech garbled or inability to speak stands for S, and that is the next step. So slurred speech.
Okay.
The next one is T, and that is time to call 911. So as soon as you have any of these symptoms start, don't go lay down, don't call your doctor, don't call your mother or father or niece or nephew and say, what should I do?
Right.
Always call 911.
Right.
Because our EMS personnel have been educated, they are very knowledgeable about stroke, and we partner with them, and they know how to identify and give us a heads up that you're coming in so we can be ready
Right.
for you.
There is an advantage there. I've heard people say, I just threw them in the car and went with them to the hospital because I knew it was supposed to be fast. But, it's so advantageous for the rescue squad to take you, for EMS to take you. It really is, because of what you just said.
And the reason I say that to call 911 is I would hate for anyone to think that they could drive and then all of a sudden they black out or they lose control of their car, because then they're going to have more problems than just a stroke.
Right, absolutely.
So always call 911.
Yeah, don't ever drive yourself. Goodness gracious. That's some of the signs and symptoms, warning signs. If you have any of this, don't ever hesitate if you think, well, they're going to think I'm crazy because I only have one sign and it's probably something. Don't ever second guess.
That's correct.
Let them do the guessing, and they're not going to think you're crazy because you called. They will be glad that you called. So
That's correct.
anyway. How do you treat strokes? I mean, when we get to the hospital, what do you do?
So the first thing we do is, let's say you come in by EMS. The first thing we're going to do is EMS is going to call us and call a code stroke.
Right.
We have a lot of code strokes.
Wow.
We had about 60 last month.
Wow.
Code strokes. We treat a lot, and we'll talk about that in a little while, how many we see. But what's going to happen is the first thing you're going to do is you're going to come in, we're going to take you straight to CAT scan. The reason we do a CAT scan first is because we need to make sure and see if it's a hemorrhagic stroke, which is the bleeding stroke,
Right.
because we'll go down a whole different pathway for treatment, or an ischemic stroke and make sure there's no blood on your brain.
Right.
If there's no blood on your brain, you have a physician and a nurse that do an assessment to see how severe your stroke is, or if you're having something else besides a stroke. Because there's a lot of things that can mimic stroke.
Right.
Such as if your blood sugar's low, that
Right.
can mimic a stroke. Other seizures can mimic a stroke. So many things can mimic a stroke. So the next step is what we do is we partner with Duke, actually, for our telestroke program. You have a board-certified neurologist that will come on a TV screen that's a robot, and they will actually talk with the patient and the family and examine the patient to see if they're having a stroke.
Wow.
And make recommendations.
That is awesome.
We called Duke, I want to say 80 times last month, just for our stroke patients, just to see if they can make any additional recommendations, things like that for our physicians.
Well, that is awesome that y'all go the extra mile to do that, and not just, oh, wow. You try to do everything and use every resource you can.
And the reason we do that is our emergency room physicians are fantastic. They're very knowledgeable about a wide span of disease processes.
Yeah.
But we bring in a board-certified neurologist that does this every single day.
Right, a specialist.
That specializes in it.
that, absolutely.
And then they help make the recommendations to the ER provider and guide the treatment of what would need to be done.
Wow. This is great information. If you would like to call in, if you've had a stroke or you know someone that has and you have a question for Mary Kay, the number's 407. It's on the bottom of the screen, 407-1111, or it has been, 407-1111. And we welcome your calls. So now, what can we do? Prevention is everything.
That's correct.
So what can we do to prevent a stroke?
So the main thing is there are risk factors, and I have them all written down because there's so many of them.
Okay.
So Some things that we can't control is our age. We can't help.
That's right.
How
We can't
wise
help it.
we've grown in our age. And we can't help what gender we are.
That's
Believe
right.
it or not, more females in our area are having stroke than males, which is above the national
Really?
average. Correct.
I would think males would.
Males do, are the highest
the
in the
national
nation.
average, but
in
in
our
our area,
hospital,
not.
more females are having stroke than males.
Wow. Mm-hmm. All right.
African Americans, of course, are more at higher risk because they have higher blood pressure sometimes.
Okay.
Things like that. Family history, we cannot control what our
exactly
loved ones
right.
have had before. So unfortunately, that is a risk factor. And a prior stroke increases your risk for a stroke in the past.
If you've had one, you could have another one.
Correct.
Okay.
Things that we can control is our blood pressure. So regular blood pressure checks with your doctor, making sure that you're taking your medications as prescribed by your doctor,
Right.
not missing dosages. Smoking and alcohol use is another big risk factor.
Right. I
Smoking
would
affects
imagine.
everything. Smoking affects
does.
your
Don't
heart,
smoke.
diabetes, it affects everything. So, if you smoke, try to decrease the amount of you smoke.
Right.
Alcohol usage is the same thing. Decrease your alcohol
Right.
usage. Diabetes is a whole different topic. Diabetes affects everything in the body, and that is a big risk factor for stroke. High cholesterol is another thing. So if you know you have high cholesterol, make sure you're taking your medications that your doctor puts you on. Make sure
Right.
that you're watching what you eat, things like that. Atrial fibrillation, or AFib, is another very big risk factor for stroke, because what happens is your heart does not pump correctly.
Right.
So what happens is little bitty clots or emboli break off, and then that causes a stroke, which gets lodged in the brain.
Wow.
So people that have AFib, making sure you're taking your medication that's prescribed for that if you're on anticoagulation therapy for that.
Wow.
Yep.
Very interesting. Okay, well, it's important to know our risk factors. So you need to listen up, think about yourself, think about, do I have any of these risk factors? And if you do, you need to reduce, as Mary Kay said, reduce. If you drink, well, cut back. If not, stop. Stop smoking or cut back. Anything you can do to cut back has to help, even if
Right.
you can't stop. I mean, the less you do, the better. So,
And with your diabetes, make sure that you're keeping a log of your blood sugars, because that's a good thing when you go to the physician, your doctor, to make sure that you can say, hey, this is what my sugar's been running. Or in the same thing with your blood pressure, make sure you're checking it regularly, because some of us only go to the doctor once a year or every
That's
6
right.
months. And a lot can happen during that time, especially if we have high blood pressure that's untreated.
absolutely. Okay, it's time for our break, Mary Kay, and we'll be right back with you. And if you want to call, as I said, 407-1111, we welcome your calls. We'll be right back to talk more about stroke.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently. So we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Looking for an affordable option to treat erectile dysfunction? Ward Specialty Pharmacy now has low-cost tadalafil troche. Compounded tadalafil troches are small lozenges that dissolve between your gum and cheek. Many ED treatments can cost hundreds of dollars. Take advantage of Ward Specialty Pharmacy's competitive pricing. 10 doses of tadalafil troches are only $80. A prescription from your doctor is required. Call Ward Specialty Pharmacy today, 252-459-5544.
The statement in this ad has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters.
For over 75 years, Allman's Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Allman's Drug Store's locations and also at our medical supply store.
Come in and see us at Allman's Medical Supply. We're an extension of Allman's Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Allman's Drug Store staff will work hard to meet your pharmacy needs. At Allman's, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Allman's Drugs today.
443-3138 or 446-0014.
And welcome back to Here's Your Good Health. In case you didn't notice, I'm not Linda. As I said in the beginning, if you just tuned in, I am filling in for Linda tonight, who's at a medical conference, and I have with me Mary Kay Baker, and she is she is a registered nurse, and she's here to educate us about stroke because it's such a very important topic. Mary Kay, let's talk some more. I think it would behoove us to talk a little bit more about the treatment of stroke in detail.
Perfect. Okay, so as we talked about earlier, stroke is a medical emergency. Every minute that a stroke is not treated, someone loses 1.9 million brain cells.
Oh my
That's
word.
A lot of brain cells, and some of us can't afford to lose
any.
Me either. So the longer you don't call, the longer you wait, the more harm you're doing to yourself. The longer the blood flow is cut off, the greater the damage there is done. Mm-hmm. Immediate treatment can actually save people's life.
Right.
With a stroke, unfortunately, we only have a window from 3 to 4 hours, 3 to 4.5 hours of treatment with a medication, which breaks up a clot.
Right.
So what will happen is that you'll come in, we'll do a CAT scan of your brain, we'll make sure you have no bleeding. We call Duke Neurology. We partner together with them, and they make recommendations for the medicine.
Right.
That is a high-powered blood clot medicine.
Right.
Now, unfortunately, not every patient is going to be a candidate for that.
Right.
It's patient-specific, such as what kind of medical history you've had in the past. Are you on certain blood thinners? But if you're not and you're able to receive that medication, it works wonders. And what it does is helps break up that clot that is interrupting that blood flow,
Sure.
so blood flow can be restored. Like I said, we only have about a 3 to 4.5 hour window for that medication. But once that medication's given, the nurse gives it at bedside. You will be monitored every 15 minutes, to every 30 minutes, to every hour for 24 hours.
Wow.
Because we want to make sure that it's working. Unfortunately, sometimes it does not work, but it's best to try to prevent, break up that clot and
Right.
restore the blood flow. So it's very important when your symptoms start. That's why we encourage you to call 911, because the sooner you get to us, the sooner we can try and treat that. There's been a lot of push in the stroke world around wake-up strokes. So the people who go to bed completely normal, have no problems at all, and wake up with arm weakness and inability to speak. So we have a lot of people in our area that do that. They come in early in the morning, about 6, 7 o'clock in the morning, and they've had a full-blown stroke. Wow. Well, unfortunately, they're out of that window for the medication because we don't know what time the symptoms truly started.
Right.
Last year, the American Heart and the FDA approved for a procedure called a thrombectomy. And what happens is, it's kind of like a heart cath. They go in and they go to the clot and they remove it.
Right.
But that can only be done up to 24 hours in a certain amount of patients.
Wow.
We've sent out 5 this month in March to have thrombectomies done. So it's becoming more and more, common.
So where do
as a
they go
treatment.
to have these done?
They can go to Duke, they go to UNC, Vidant does this also. Unfortunately, we do not do it at Nash, but we identify it and we send them out
And
for
that's
that treatment.
good. That's good right there. Yeah,
Correct.
absolutely.
Correct.
Now, Mary Kay, people tell me all the time, I just had a TIA or a mini stroke, or can you explain the mini stroke, the TIA versus the full-blown stroke? Can you explain kind of the difference?
Yes. A stroke is a stroke, whether it is a mini stroke or a big stroke. The big stroke, of course, would be your ones that are unable to walk, unable to speak, in a nursing home the rest of their lives. A minor stroke would be, you had a stroke, you had facial, you still have facial droop, but it's not debilitating. What a TIA is, or is called a transient ischemic attack, is where there is an interruption of blood flow for a short period of time and all your symptoms go away. We are still going to work you up to make sure that you have not had a stroke, but there is normally no damage on your MRI with a TIA.
Wow.
So the term mini stroke is, if you say that they say you had a mini stroke, you may have had a TIA if your symptoms completely resolved, but if you had a mini stroke and you still have symptoms, you had a stroke.
Wow.
Right. Not every stroke is debilitating. We have some people that have had a stroke and are back at work. But the main thing is making sure you call 911. So
No matter what.
Right. So we can at least examine you and attempt to do everything we can for you.
Okay. How common are strokes?
Strokes are very, very, very common.
Because there's a myth out there that strokes are not common.
They are common. Every 40 seconds in the United States, someone has a stroke. Every 4 minutes, someone dies of a stroke in the United States. Stroke is the 5th leading cause of death. It used to be higher, but with all of our education and our public education and knowledge, people are coming in getting treated so we can treat them sooner.
That is great.
And it's the leading cause of disability. North Carolina is known, as well as South Carolina and Georgia, as the stroke buckle. So there are a few states in the lower part of the United States that have higher strokes. And the reason's really not known, but we can assume it's our barbecue, our fried chicken, not taking our medicines like we're not taking our medicines like we're supposed to. North Carolina is known as the stroke buckle.
Right.
We have a lot of strokes in North Carolina. Edgecombe County is one of the #1 counties in North Carolina for strokes.
Wow.
And that's where we are.
diabetes and other things.
Right.
Wow.
Right. So yes, the reason, like I said, is really sometimes unknown. Unfortunately, some patients have to determine whether do I take my blood pressure medicine this month or do I feed my family?
Right.
Or
And that's sad.
And that is sad.
sad.
That's very sad. But a lot of, especially in the eastern part of North Carolina, that is one of the reasons is, lack of access to medical care.
Right.
Things like that.
Right.
So it's very common, very common.
Wow.
We last year at Nash treated 487 strokes. Just as a primary diagnosis, we had over 750 strokes total at just Nash.
Last year at one hospital.
Yep. So we're very
Goodness
busy
gracious.
with strokes.
Well, and we'll talk about this a little bit later, but you all have gotten tremendous accolades. It's a wonderful place to go, Nash UNC. We're lucky, we're fortunate that because we are the stroke buckle or whatever, because our numbers are so high, we're so fortunate that Nash UNC has, people like you that are very educated and know exactly what to do. So anyway, so strokes are common.
That's correct.
Very
It does
common.
not just affect the elderly like people think. It can happen in all ages. Some pediatrics Thank goodness we don't see a lot of them in our area.
Wow, you don't think about that.
There are some that happen inside the womb before they're born.
Goodness gracious.
Thankfully, we don't see a lot of, I can't recall any pediatrics that we've had at Nash that have had a stroke in the emergency department. We have had some as young as 24 to 25 that have had strokes, as well up to 103. So it just does not discriminate. The majority of the age group that we see, though, is between 60 and 80. But we do, I mean, we have had a very high increase in less than the age of 50 with strokes.
What is the, I mean, you know, I don't need to know the number, but, or the percentage, I don't guess, but how many people are able to go to rehab? I mean, is it a good number that are able to go to rehab and
So I just ran some data recently, and we send over half of our patients home from that. The ones that do not need rehab, or they can do rehab at home with home health. So we do a very good job of making sure we get our patients back. The ones that do go, we send about 19 to 20% of them to rehab, whether that be at our local facility, BTAR, or to a nursing home for rehab to get them back to what they were before, safe to go home.
How many deaths have we had, do you know, in the last year because of stroke?
We've only had about 3% of our total.
Really?
And they were because the family made them comfort measures because their stroke was so bad.
Right. Wow. Well, that's good to know. Gosh, that has really improved.
Now we do when we send some out, those we may have some that were really, really bad that, you know, expired or passed away at another facility, but at ours it's about 3%.
Wow. Well, that is great. That is great numbers. Okay, well, we want to talk about, when we come back, we're going to take a break. When we come back, we want to talk about the Nash Stroke Program. We want to talk about some awards that the hospital has won. I'm excited about that, so we'll be right back with you on Here's to Your Good Health.
At Downey's Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently. So we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Downey's Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Downey's Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Looking for an affordable option to treat erectile dysfunction? Ward Specialty Pharmacy now has low-cost tadalafil troche. Compounded tadalafil troches are small lozenges that dissolve between your gum and cheek. Many ED treatments can cost hundreds of dollars. Take advantage of Ward Specialty Pharmacy's competitive pricing. 10 doses of tadalafil troches are only $80. A prescription from your doctor is required. Call Ward Specialty Pharmacy today, 252-459-5544.
The statement in this ad has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Stores locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
And welcome back to Here's to Your Good Health. I am with tonight Mary Kay Baker. And as I said, Linda is gone, but she'll be back next week. So I'm filling in. I want to talk a little bit about, heart. When I was doing the heart month, they said, time is muscle, time is muscle. Well, now Mary Kay tells me with strokes, the time is brain.
Correct.
Right?
Correct.
So elaborate on that a little bit.
So remember the be fast. You recognize your signs and symptoms. Call 911 immediately. Because like I said, the more time that you don't call 911, the longer it is, the more damage you're doing to your brain.
Right.
So those are areas of the brain that we can't get back.
Right.
So that's why it's very important when you think you're having a stroke, you think your loved one's having a stroke, don't wait. Please
Right.
call 911. We would rather you call instead of not calling and you coming in later, and unfortunately there's little that we can do
Right.
for treatment.
And that's sad when the help is right there.
Right.
So,
And like we only have that short amount of window for that medication if you're eligible, 3 hours, some patients up to 4.5 for treatment. So it's very important that you call as soon as possible.
absolutely. Let's go back and talk a little bit about, we can move forward. What do you want to talk about now? I'll let you choose what we talk about now. Do you want to talk about the stroke program?
Sure.
The Nash stroke program?
Sure. So we applied for to become a primary stroke center, which is accreditation through the Joint Commission. So we applied in 2016 and had our survey in November. It's a very tedious survey. You have a surveyor from the Joint Commission who gives us permission to apply for this program. They come in, they interview staff, they interview physicians, they interview patients, they look at charts, they look at everything underneath the sun.
Wow.
And they look to make sure and they look at data, they look to make sure that you're doing and providing the best practice for stroke patients.
And that's a good thing.
Correct.
For
correct.
the public.
Correct. So being a primary stroke center, we have proven that we do what's best for the patients. We practice best practice. We follow the guidelines set by the American Heart
Right.
and the Brain Coalition. So we do that. We have to keep that up. We were just recertified in January of this year, so we're good for another 2 years.
Wow.
That means we have to keep a lot of data. We have to prove that we're doing what we do.
Sure.
And we're doing it correctly according to best
And I
practice.
believe you have an award with you, don't you?
I do.
Let's hold it up.
We won.
Look at that.
Yay! Yay! We started in 2016 with Get With The Guidelines, and it is a program where we put in stroke data on all of our stroke patients. And we started at bronze, silver, and then last year we received, second year in a row that we received gold plus. So what that means is that we have been at least 85% or more compliant with our stroke data and our stroke compliance for stroke patients. This year in 2019, we are going to receive Gold Plus again,
Oh, wow.
which means that we do great work at Nash. I'm very proud of the nurses and the physician. We have a great team of nurses that deal with our stroke patients.
Have a great team.
Correct.
Yes, and that's so good to know. It's so, to me, living here is very comforting to know that we have this treatment for stroke, because I have an elderly mother. You just never know. You've got grandparents, and you think about these things, but of course you said earlier that it doesn't necessarily just hit the older folks either. So we all have it too. We must go back to our risk factors and work on those for prevention. Prevention is just everything, folks. It is everything.
Everything.
It is just so important. Let's go back and talk about a little bit about Mary Kay, what is a TPA? I didn't ask you that.
So
now, we talked about a TIA and a full-blown stroke, but I forgot to ask you what a TPA is.
So TPA is the medication that we can give for a stroke. So up to that, up 3 hours, some patients 4.5, and that's that blood thinner anticoagulant that we give you.
Okay.
Right. And what happens is it goes in through your IV, and it binds to whatever clot it is and try to break it up and prevent new ones from forming.
Wow.
So last year alone, we gave 59 cases, which is higher than average for stroke patients because we see a lot of strokes. We've had some really great successes from it. Of course, with any medication you take, there are risks, but that would be something the physicians would talk to you about, making sure that you understand the risk and benefits from it.
So the risk of the stroke and what it can do versus not having the medicine,
correct.
You have to weigh that. And
Correct.
I guess that's what the doctor does.
Correct.
He has to weigh that.
Unfortunately, like I said, not all patients will be candidate for a medication, depending on what medical problems you have, what medicines you're on, because some medicines that you're on exclude you from that, but majority of our patients do get the medication and are eligible.
Right.
So a lot of people are scared of it. They say, oh no, I don't want to bleed in my brain, but the physicians tell you that there's about a 6% chance of bleeding from that medicine.
Right. Well, let's go back and talk a little bit about myths about stroke.
Okay.
And
so a myth, stroke cannot be prevented. We talked about that. Strokes can be prevented. 80% of all strokes are preventable, such as, making sure you're checking your blood pressure, making sure that you're checking your sugar, taking your medications as prescribed, regular doctor's appointments. Especially if you come into us and we discharge you home, we give you follow-up appointments. Please make sure that you keep your follow-up appointments.
Absolutely. I hear people tell me all the time, well, I haven't been to a doctor in 20 years. My goodness, get there, because that is so important. Knowing your numbers.
Correct.
You can go on medication that, can lower your numbers, and, voila, it can prevent a stroke. So, if you don't have a physician, please get one. It's just so important to have a doctor.
Another myth is stroke recovery only happens for the first few months of a stroke. That is incorrect. We have a patient family advisory that sits on our stroke team. He had a stroke back in 2013 or 14, I believe, and he's still improving every day.
Right.
He was unable to walk. He was unable to dress himself. He now drives to the hospital and comes to our meetings. So it's not just in those first few months. Sometimes it can take a year or 2 years to regain your strength and stuff back.
With what you do, how rewarding is that to see patients like that were debilitated and then come back and they're just their normal self?
I have
How
one that
rewarding
really
is
just sticks out to me. And he holds a special place in my heart because of, then all of my patients do, but I happened to be his nurse that day, and he was completely fine. And he came in by EMS because he had a headache. And EMS all of a sudden called us back and said, he has right-sided weakness, he can't talk. We gave him the medication, and he was pretty bad off stroke. We sent him out to a higher level of care, and I called his wife the next day and just to check up on him, and he was talking a little bit better. Well, then I called the next day, and then he was walking out of that hospital.
Oh, wow.
And, thinking that he was going to be in a nursing home the rest of his life. It's just, it proves why we do what we do.
Right.
It's
makes
because
it all worthwhile.
our goal is to get people back home to to their family, to where they belong.
Oh, what a story. That is a great story.
Yep.
Wow. Okay.
Strokes are not hereditary. That is a myth too, because family history of strokes increases your risk for
we talked
stroke.
about that earlier.
We did talk about that.
Family history is very important.
If a stroke symptoms go away, you don't have to see a doctor. That is a myth. As I talked about earlier, that is a TIA. We've had a patient come in who called 911, did like he was supposed to because he had signs and symptoms of a stroke. His symptoms went completely away. While he was in the emergency room waiting to be admitted, his symptoms came back as a full-blown stroke. So we were able to give him that medication, and he went home 3 days later with no problems.
Wow.
So if you have your symptoms, don't wait at home. Please call 911.
Because a TIA can turn into a full-blown stroke.
It is a warning sign that something is wrong, and we need to figure out what caused those. Whether is it your high cholesterol, are you a diabetic and you don't know it? Was your blood pressure so high? So it's very important to call 911 when those happen.
When you have a stroke, are you mostly on, what do you call it, blood thinning medication?
Afterwards?
Yeah, for a long time, or?
The guidelines say that you need to be on certain medications, but it's going to be patient specific. Your physician will collaborate with you and other providers to figure out what's best medication for you to be on.
Right.
So a lot of people do go home on a...
I guess I was thinking about Plavix.
Right.
Yeah, that's what it was.
Some people may go home on an aspirin, some people may go home on Plavix, but it's all going to depend on what's best for you.
Right. Okay.
Another thing is, the guidelines say that a patient that's had a stroke needs to be on a statin, which is a cholesterol medicine, but that is going to be specific to the patient because there are certain things that you can't take a statin if you have this problem.
Right.
So therefore, it's going to be patient specific, and your physician and you will discuss that.
Okay, very good.
Stroke only affects the elderly. We talked about that just a few minutes ago. It can affect everyone. So even if you're in the young age and you have your signs and symptoms of a stroke, please call 911.
Yes, always call 911.
Yep.
Well, very good. So, talking about strokes, I want to ask you, it's very scary for the patient. It's just a very scary thing. Do you have to calm them down? They can't talk. I mean, I've seen, I knew a personal case where someone said, they were trying to tell somebody. That's got to be very scary for the patient.
Correct. It is scary. It's not only scary for the patient, but it is for the family. So in the code stroke process, you have a lot of stuff being done to the patient, so that alone is overwhelming. You being in an emergency room is overwhelming. So our best thing is to try to explain what's going on. If the patient can't talk, but they look like they want to talk, I've given patients a pen and a piece of paper and have them try to write down, because they may have something that we are not explaining. So we do try to accommodate for that. We have some great nurses in the emergency department that do a great job with that.
And I guess that's good to let them write it down, because they can't tell you what they are feeling, symptoms that they're feeling maybe that you haven't noticed.
There's been times I played charades in the emergency room trying to figure out what they wanted. I'm acting out, things like that. So anything to try to calm them down.
Oh, that's fun. That's a good idea. Yeah. Very good. I know that you're good at what you do. So, all right, we're going to take our last break. We'll be right back with you to end the show up.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently. So we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Are you suffering from chronic pain? Have aches, migraines, or just general discomfort? Ask Ward Specialty Pharmacy about their new pharmaceutical-grade, full-spectrum hemp extract, commonly called CBD. CBD has no known side effects and is available without a prescription. CBD can potentially help with migraines, anxiety, depression, insomnia, and other discomforts. Ask the knowledgeable staff at Ward Specialty Pharmacy about CBD and start feeling like yourself again. Ward Specialty Pharmacy, 3646 Sunset Avenue, Suite 110 in Rocky Mount.
The statement in this ad has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Welcome back to Here's Your Good Health. We want to go back over, because it's so important, and I know there are some of you that might have been having dinner and that you might have just tuned in midway the show. We don't want you to miss the signs and symptoms of stroke, because it is so important, because we do want you to be fast, get there fast. So we're going to show you again some graphics, some pictures, and Mary Kay will explain those to you.
So the first one is B, which means a sudden change in balance or coordination. So if you're standing there and all of a sudden you feel like you are dizzy, can't hold a coffee cup, can't do what you were doing. It's just a sudden change in balance or coordination. E stands for eyes. So a sudden loss of vision in one or both eyes, whether it's blurry vision, loss of peripheral vision, any kind of vision change is a sudden vision change. F stands for face. So you have facial droop, can only smile on one side. So you smile and your family say, oh, your face looks funny. Your face, I often hear my face was twisted is what I hear a lot. So a sudden facial droop, can only smile on one side. A stands for arms. So you can't hold both arms up, or you have arm weakness, such as that coffee cup again, or you're writing and your pen's not going how it's supposed to go. So A stands for arm. S stands for speech. So slurred speech or garbled speech, or inability to speak. So if we're sitting here talking and my words just don't come out, that could be a sign of a stroke. So S stands for speech, and T is one of the most important ones of all, which is time. So it's time to call 911. Not time to call your doctor, not time to call your relative. Right. Time to call 911, because the sooner you call 911, the sooner you get to us, and we can help treat that.
Absolutely. Time is brain.
Time is brain,
as they say. So We can come back now, Lee. Okay, thank you. We've talked tonight about stroke in great detail. We do appreciate Mary Kay. Now, she speaks, she educates on stroke at various places. So if you have a church group that wants her to speak, a civic group that wants her to speak, and I might get you to speak at my civic group or my business club or anything like that, let her know. And can you give a contact number?
Yes. My work number is 252-962-8575.
And she will be happy to come to your place and give a presentation because this is so important. It really is. We can't talk enough about it, but we do congratulate Nash UNC for the awards that they have won. How many years have you won awards for stroke?
We started in 2016.
Wow.
So 16, 17, 18, and this is our 4th year.
That is great. Absolutely great.
Very proud of our staff. They do a great job. Our frontline nurses are phenomenal. They really are.
Now, if someone, where would they see you if they come into the emergency room?
So I'm not as on the front for it as Mark anymore. I do go out.
A lot.
I go out and do education. I do respond to Coach Strokes as my time allows if I'm there. So they may see me in the emergency department, or they may see me on rounds on the floor. If they're in the hospital, just like I said, just call me if you want me to come up and see you. I would love to meet you. Unfortunately, hate it would be there. If I can ever be a resource for anyone, please call me. So
Wonderful.
that's where they would see me, is mostly in the emergency department.
Right. Okay. And please don't forget to call 911. It's so important.
Time is brain.
Time is absolutely brain. So we thank you for watching tonight. Here's your good health. Thank you, Mary Kay, for being on.
You're welcome. Thank you for having me.
So knowledgeable. I want to thank Nash UNC for sending you, because you're so knowledgeable and so good at what you do. That makes us feel really good that Nash has people like you over there taking care of us if we need it. So anyway, thank you for watching tonight. Have a great night. We'll see you next week with Linda.